Let's talk about myxedema coma. In myxedema coma, it's basically this is the definition: severe hypothyroidism resulting in decompensated metabolic state and an altered mental status. In myxedema coma, it's somebody with a severely low thyroid hormone. And what does hypothyroid even do? It's something that's responsible for slowing down the BMR. Remember, hyperthyroidism was to do with increasing basal metabolic rate and sympathetic nervous system activation. Hypothyroidism is responsible for slowing everything down. But think of myxedema coma as something getting so slow to the point of death. It's severe hypothyroidism, decompensated metabolic state, and even an altered mental status. Now, what is the normal functioning of the thyroid gland? Well, the hypothalamus releases thyrotropin-releasing hormone, which causes the anterior pituitary to release thyroid-stimulating hormone, which causes the thyroid gland to then release T3 and T4. For T3 and T4 to form, we need iodine. So that's why in conditions like iodine deficiency or Hashimoto's thyroiditis, they can develop hypothyroidism. But let's talk about a myxedema. Myxedema is a severe, slow, close to death, life-threatening situation where a patient who is a known hypothyroid is now facing some kind of stressful situation like sepsis, infection, or stroke. And this is causing them to then enter this severe hypothyroidism, which is then going to come along with severe hypotension, severe hypoglycemia, and severe hyponatremia. Okay, if you're in hypothyroid, you no longer have need for gluconeogenesis or to keeping the glucose up. You're going to have hypoglycemia. The reason you have hyponatremia and hypotension as well. So slowing down to the severe point of coma. What does a myxodemotus patient look like? Well, they have this thickened, non-pitting edema of the skin. By the way, this affects elderly women around the age of 60. Here's a picture. And myxedema coma commonly presents with a thickened, puffy face with hair loss, thinning hair loss, a puffy face with cool extremities, and they have this swelling around the eye. You can see she has a doughy skin texture with a puffy face with puffy eyes. And what's this called? This is called and then this myxodemotus state. Okay, so peritibial, periorbital edema. Okay, so the other thing to mention is that while in hypothyroidism, these patients have a cold intolerance. In myxedema, it's so severe that it's actually hypothermia at this stage. Now, you want to put these patients are often on oxygen support and life support. So you're going to give them levothyroxine to up their thyroid hormones. A little bit about hypothyroidism itself. Hypothyroidism can be caused by an autoimmune condition such as Hashimoto's thyroiditis. Or it can be iatrogenic. So due to somebody taking drugs for, let's say, hyperthyroidism, like carbimazole, methimazole, propylthiouracil, and those drugs being in too high a quantity, and actually that person who was initially hyperthyroid are now taking inhibiting drugs of thyroid hormone, which is then going to make him hypothyroid. There's two drugs like lithium and amiodarone whose side effects is including hypothyroidism. The other thing about hypothyroidism is that it's a deficiency of T3 and T4, triiodothyronine and thyroxine, and these patients are often female because females are often affected with autoimmune conditions like Hashimoto's. They're older than 60, they have family history of thyroid disease or autoimmune diseases, others like type 1 diabetes or celiac. Symptoms include fatigue, bradycardia, cold intolerance, cool, dry skin, weight gain despite poor appetite, constipation, decreased GI motility, decreased heart rate, and even myopathy, muscle pain, stiffness, cramps, etc. Now, you can talk about myxedema coma here as well. Your investigation is going to be thyroid function tests, and your treatment is going to be levothyroxine.